Welcome everyone, my name is Veronica Schiariti. I am a developmental pediatrician and a global child health researcher at the University of Victoria in Canada. I am delighted to present this paper on behalf of my co-authors and the CPCDE's Oversight Committee. The title of the paper is Cerebral Palsy Pain Instruments, Recommended Tools for Clinical Studies by the National Institute of Neurological Disorders and Stroke, Common Data Element Project. The NINDS and the American Academy of Cerebral Palsy and Developmental Medicine have been collaborating in the CP Common Data Elements project since 2015. We were pleased to publish in 2018 the first paper describing the development of the CP Common Data Elements, and recently we complemented the information with the CP pain instruments that we describe in this paper. As I mentioned, this is the first paper that was published in 2018 dedicated to the development of the common data elements for clinical studies with children and youth with cerebral palsy. Let's define what a common data element CDE is. The CDEs consist of specific terminology with identification of common definitions, standardized case report forms, and standardized tools or instruments. CDEs and tools are classified with regard to level of recommendation for use in research studies. The main recommended categories are core, supplemental, highly recommended, supplemental, and exploratory. You can find the full description of each recommendation on Table 1. The CPCDEs were developed as data standards for clinical research in neuroscience. However, there were some content gaps. We previously acknowledged that chronic pain was underrepresented in the first version of the CPCDEs. To fill this gap, this study describes the process of updating the CPCDEs, specifically identifying tools that capture the impact of chronic pain on children's functioning. Our interdisciplinary team consisted of clinicians and researchers working with children and youth with cerebral palsy. We conducted a multi-step methodology including a scoping review. We created an adapted CP chronic pain tools rating system. We review psychometric properties of each measure. We review the clinical utility and compliance with inclusion and exclusion criteria. Lastly, a set of recommended pain tools was posted online for external public comment in May 2022. You can see the timeline of the project in the online appendix number 3. After a rigorous process, 15 chronic pain tools met inclusion criteria, representing content across all components of the ICF. Table 2 shows a detailed description of each recommended measure, including the purpose, the psychometric properties, the representation of PROMIS pain domain and ICF domain, and CDE's recommendation level. 8 out of 15 were classified as supplemental. The rest were exploratory. Importantly, in the discussion, there is a dedicated section and a figure that guide readers on how to use these recommended tools, illustrating how to select the best chronic pain measure for your practice or your study, depending on the age of the children that you are seeing, the purpose of the pain assessment, and the pain domains. The guiding framework of the project was the ICF, so we also organized the results by ICF domains. We want to emphasize that no single tool covers all the ICF components, so a combination of measures is needed to truly represent the impact of chronic pain on the daily functioning of children and youth with cerebral palsy. You can find examples and more information on Figure 1b. Lastly, we acknowledge that the current proposed set of tools underrepresent some functioning areas, for example, impact of chronic pain on sleep pattern, coping strategies to stress and chronic pain, and attitudes towards pain that are based on belief or cultural and ethnic backgrounds. In conclusion, the proposed chronic pain tools harmonize the assessment of chronic pain in children and young people with cerebral palsy. And most importantly, the contribution of this paper is that the new CP pain common data elements address the functional impact of chronic pain in everyday activities in children and young people with CP. You can access this open access paper on different platforms. You can access this on the Journal Developmental Medicine and Child Neurology website, on the NINDS CPCDE's website, and also the AACPDM website. Thank you for your attention.